Hello everyone, welcome to Jessie's MedBio. In today's section, we are going to discuss about the last topic from the first chapter, that is child health nursing procedures. In this topic, around four subtopics are there. So first one is administration of medications, oral, intramuscular and intravenous. Then second one is calculation of fluid requirements. Third one is application of restraints, and fourth one is assessment of pain in children. So first is the administration. So during our first year itself, we all studied about the administration of medications in the fundamentals of nursing. So here I am just giving an overview about all three types. So first one is the oral administration. Oral administration is the process of giving medicine through the mouth in the form of tablets, capsules, syrup, suspension, drops or solutions. So the procedure is, first we have to identify the child, then we have to explain the medicine, then we have to position the child in an upright, then we have to give the medicines appropriately. If it is a liquid medicine, for the infant child, we have to use the oral syringe to give the medications. First, we have to place the syringe inside the cheek. Then we have to give the medicine slowly in small amounts. If it is a older children, allow the child to drink the medicine independently if possible. Then we have to offer the water after the medicine if appropriate or if necessary. Then we have to ensure the child swallowing the medication completely if it is a tablet. That is about the oral administration. Then IM administration, that is intramuscular medication administration, is the process of injecting a prescribed medication directly into the muscle using a sterile syringe or needle. If it is an infant below 12 months, we are giving the medication or the medicine into the vastus lateralis muscle. If it is a toddler, we are giving vastus lateralis or ventrogluteal muscle. For the child who is above 3 years, we are giving in ventrogluteal or deltoid muscles. For the procedure, first we have to wash hands and wear gloves, draw up the prescribed medication using aseptic technique, position the child securely and expose the injection site, clean the site with an alcohol swab in a circular motion and allow it to dry. Then stretch the skin, or we can use the appropriate technique based on the muscle mass. Then hold the syringe like a dart, insert the needle at a 90-degree angle into the muscle, inject the medication slowly and steadily. Then we have to withdraw the needle smoothly, then apply gentle pressure with a sterile gauze. We should not massage the site after giving the medicine. Then we have to dispose the syringe and needle immediately in a sharp container. Then we have to make sure that the child is comfortable. Then third one is the IV administration. Intravenous medication administration is the process of administering a prescribed medication directly into a vein through an intravenous cannula or venous access device using aseptic technique. For the procedure, first we have to verify the doctor's prescription and we should follow all the 10 rights of medication administration. Then we have to perform the hand hygiene, wear the gloves, prepare the medication. Then we have to confirm the child identity, then explain the procedure. After that, we have to assess the IV cannula site for patency, redness, swelling, pain or leakage. Clean the IV injection port with an alcohol swab and allow it to dry. Attach the syringe containing the medication to the IV port. Then we have to administer the medication slowly at the prescribed rate. Then flush the IV line with normal saline if prescribed to ensure the full dose is delivered. Then observe the child continuously for any signs of discomfort or adverse reaction. Then we have to remove the syringe and maintain the IV line as ordered. Then dispose the used material safely in the sharp container. Then make sure that the child is comfortable. That is all about the administration of medication. Then we are moving on to the calculation of fluid requirements for the child. Calculation of fluid requirements in child is the process of determining the amount of fluid a child needs in 24 hours to maintain the normal hydration, electrolyte balance and body functions. Which means calculation of fluid requirements means that it is the determination or it is the identification of amount of fluid a child need for 24 hours. For the calculation here they are saying that for first 10 kg, 100 ml per kg per day we are giving. For second 10 kg, that is from 11 to 20 kg, 50 ml per kg per day we are giving. For about 20 kg, 20 ml per kg per day we are giving. For an example, if the baby is having a weight of 8 kg, how we are calculating means, as I already told that for first 10 kg, we are giving 100 ml per kg. So if it is 8 kg, it is coming in the first 10 kg. So we are giving 8 into 100, 800 ml kg per day for the child. Then if it is 15 kg, as I already told, for first 10 kg it is 100. So here remaining 5 kg is also there. So I told that for the second 10 kg it is 50. Right. So here for the next 5 kg we are multiplying the 50. So 5 into 50, that is 250 ml. For the first 10 kg, that is 1000 ml. So we are adding both these. So we get the total of 1250 ml per kg per day. That is about the calculation of fluid requirements. Then third topic is the application of restraints. Application of restraint is the use of a protective device or method to temporarily limit a child movement in order to prevent injury. For what purpose we are applying a restraint to a child means to temporarily limit the movement of the child, to prevent any injury and also to do any type of diagnostic or therapeutic procedures. So the procedure or the principle is, first we have to verify the doctor's order and we have to explain the reason to the parents, then perform hand hygiene, then we have to select the correct type and size of restraint, then check the child's skin condition and circulation before application, then apply the restraint to the child slowly without causing any discomfort. Then we have to ensure that the restraint is not too tight or not too loose. You should be able to insert 1 or 2 fingers between the restraint and the child's skin. Then after that, we have to secure the restraint to the bed frame. Then position the child comfortably. Then assess the circulation, skin color, temperature, sensation and movement every 15 to 30 minutes. Then remove the restraint at regular intervals to provide the skin care. Then provide range of motion exercises. Then we have to observe the child continuously. Then document the type of restraint, reason, time of application, assessment and time of removal. All these things we should document at last. Then I'm going to explain about some type of restraint. So first one is the mummy restraint. It is one of the important restraint. A method of wrapping an infant or young child securely in a blanket to limit the movement. That is the mummy restraint. The purpose is to immobilize the child during examination, like eye examination, ear examination, head and neck procedures, venipuncture and suturing minor wounds. For that purposes, we are giving the mummy restraints. Then elbow restraint. It is a padded splint applied to the elbow to prevent the flexion. The purpose is to stop the child from touching the face or surgical site, like after the cleft lip surgery or after cleft palate surgery, or to prevent the removal of nasogastric tube or IV lines. To prevent these type of movement, we are applying the elbow restraint. Then third one is the mitten restraint or hand restraint. A soft padded mitten placed over the child's hand to prevent the grasping. The purpose is to prevent the scratching or pulling at the medical devices, like to prevent the removal of IV cannula, to prevent the removal of feeding tubes, prevent the scratching of skin, lesions or wounds. Then fourth one is the clove hitch restraint. A soft restraint applied to the wrist or ankle using a clove hitch knot. The purpose is to temporarily limit the movement of an arm or leg during the IV therapy or during the blood sampling or during the diagnostic procedures. Then fifth one is the jacket restraint. It is a vest-like restraint secured to the bed or the chair. The purpose is to prevent the fall and keep the child safely positioned. Like prevent the child from climbing out of the bed or prevent fall from the chair or wheelchair. The last one is the limb restraint or wrist or ankle restraint. Soft restraints apply to the wrist or ankle to resist the movement. The purpose is to prevent the interference with the treatment. While we are doing any type of procedures or like medical or therapeutic procedures, at that time for restricting the movement or limiting the movement of the child, we are applying the limb or wrist restraint. That is about the application of restraint. The last topic is the assessment of pain in children. Here mainly we are using 3 scales. First one is the Faces pain scale, second one is the flag scale, and third one is the numerical rating scale. So first one is the Faces pain rating scale. Before that, pain assessment in children is the systematic evaluation of a child's pain intensity using age-appropriate pain assessment tool. Pain assessment means we are evaluating the intensity of pain in the child. So first one is the Faces pain rating scale. It is also known as Wong-Baker Faces pain rating scale. The Faces pain rating scale uses a series of facial expressions to help the children describe the intensity of their pain. The child chooses the face that best matches how they feel. Here we are using a different type of facial expressions. From that, the child is selecting one that matches how they feel. The age group is 3 years and above. The children who can understand the pictures, because a pictorial format we are giving. For the procedure, first we have to explain the scale to the child. We have to show the faces. 6 faces are there. Then we have to ask the child to point the face that best shows how much they are hurt. Then we have to record the corresponding score. Here we can able to see the image. Around 6 images are there. 0 means no hurt, 2 means hurt little bit, 4 means hurt little more, 6 means hurt even more, 8 means hurt whole lot, and 10 means hurt worst. That is about the Faces pain scale. Then here the flag stands for F is face, L legs, A activity, C cry, and C consolability. The age group is 2 months to 7 years and also used for the children who are unable to communicate. Then this is the flag pain scale. Here we can able to see the 5 category on the left side. Then 0 means relaxed, 1 means mild discomfort, and 2 means severe discomfort. According to this, we can able to identify the intensity of pain. Here 0 means relaxed and comfortable. If it is 1 to 3, that is mild pain, 4 to 6 which means moderate pain, and 7 to 10 means severe pain. The maximum score is 10. Out of 10 we will get one value. If it is 3, if it is coming as 3, then it is a mild pain. If it is coming as 8, then it is severe pain. Like that we can able to identify the intensity. That only they are explaining here also. For the procedure also, we have to observe the child for 1 to 5 minutes. Then we have to assess all these 5 categories. Then we have to assign the score from 0, 1 or 2 for each category. Then add the score to obtain the total pain score in out of 10. Then we have to talk about. Then third one is the numerical rating scale. Numerical rating scale allow child to rate their pain by choosing a number from 0 to 10, where 0 means no pain and 10 means the worst possible pain. The age group is from 8 years and older, the child who can understand numbers and quantify the pain. Here we are using the numbers to identify the intensity of pain. Then the procedure is explain the 0 to 10 pain scale. Ask the child on a scale of 0 to 10, where 0 means no pain and 10 means the worst pain possible, how much pain are you feeling? Then record the child response. Reassess after pain management. This is the image for the numerical rating scale. By showing this scale to the child, we are assessing or identifying the intensity of pain. So that is about the pain assessment in children. So in today's class, we discussed about the child health nursing procedures. Under that, we discussed about the administration of medications, calculation of fluid requirements, application of restraints, and last, pain assessment in children. These all about our first chapter in child health nursing.